Okay, our next speaker is Fintan Feerick. He's part of the National Ambulance Service. He's a paramedic. He's really enthusiastic about research. He's doing a PhD. And I tell you what, he's somebody you wanted to conference every day, because he was sitting behind me and he's going, wow, that's really interesting. Ooh, oh, isn't that interesting? And I could see the ideas sparking. And yeah, I'd be really interested to hear his talk. He's going to be talking about what the GP's attitudes are when you introduce paramedics to their services. So I look forward to hearing it.
Thank you very much. Thanks very much, guys. It's a pleasure to be here, and thanks, Mike, for setting the bar so high. Yeah, now I have to try and follow that and meet up to it. But yeah, so listen, this is just a piece of research that I did with my colleagues in the medical school in the University of Limerick, and it was part of a master's dissertation. And I was delighted to say that I had the opportunity to have it published in BMC Primary Care earlier this year as well. So we were really pleased with that. So it was really looking at introducing advanced paramedics into the rural general practice team in Ireland. And I suppose just to outline from the start, private practice for our international audience, general practice in Ireland is predominantly private. Okay, so what this concept was looking at was a collaboration between public and private two different entities. So that was I thought that was going to be a challenge in itself, and to be honest, it really my own expectations, my biases, I suppose, that I maybe probably carried into it were completely dismissed once I engaged with the GPs and understood their background. So really, it was obviously the background behind it is obviously the increase in chronic disease, as we know in Ireland, is really outweighing the demand on the services that we can provide. And general practice and healthcare workforce shortages is a problem not just in Ireland, but it's a global problem, as we all know. But it's becoming really problematic especially in rural general practice in Ireland. And this has been advocated time and time again. So I just thought there was something that, as an advanced paramedic clinician working closely in primary care and pre-hospital care in Ireland, but I just thought there's something that maybe we could actually bring to the table. And the concept really that this came from is I suppose, coming from the World Health Organization did a position paper on this, on task shifting. And really the principle about it is using healthcare workers to do other things other than what they were trained to do. And I just felt that was something we could look at. So the whole aim of this really was predominantly it was GPs alone, just general practitioners, and their attitudes and opinions of integrating advanced paramedics into their rural general practice team. So how did we go about it? So mixed methods, so quantitative and qualitative studies. So I surveyed the GPs. It was done over two phases over 1 year. So the first phase of it actually was pre-COVID, if people can actually remember that. So it was actually at a rural GP conference held in the Midlands. And there was 27 GPs completed the survey on that, so that was fantastic. So that then informed the next phase, which was the semi-structured interviews. Now this was a challenge, as we all know. I know this conducted research during lockdown. This presented its own challenges, but also its opportunities, because I had to get to speed very quickly with Zoom and Teams and all the rest. And also I was developing as a novice researcher as well. So with that, then I conducted 13 semi-structured interviews online with GPs who were very busy, and we're very, very grateful for them for giving their time towards this research. And that was recruited through the Irish Rural Dispensing Doctors of Ireland, so they really deal with very, very rural and remote patient care. And then, of course, the interviews were transcribed and verbatim and thematically analysed. So again, I'll skip over this, because this just really to re-emphasise again, just for our international audience, that the fact that this was looking at a private-public partnership. So some of the things. So the questionnaire, the first questionnaire we put to them was just to the general GPs, and again, this replicated a lot in relation what the literature is already saying in relation to general practice in Ireland. So as you can see, the age of our respondents, we had 27 respondents in total from the survey. This was at the conference. And as you can see there, that 19 of them were over 60 years of age. And this is a huge problem. I think we're going to have running towards a shortfall of 2,500 GPs in Ireland by 2025, I think. And rural Ireland has disproportionately been affected by the lack of GP cover. And then there's just a mix. Obviously, it was predominantly rural practice. Most of them were GP trainers, and again, that might tie into why they were so enthusiastic about getting involved. That's maybe just another finding. And as you can see there, their practice numbers. So the familiarity with AP practice. So really what we're asking was, were they familiar with what we do, what I do, and my colleagues do on the road? And so what was interesting there was that 15 were familiar with and had interaction with advanced paramedics. 9 were unfamiliar and 3 were undecided. I'm not sure what that meant, but they weren't sure whether they knew us or not. So there was a whole range in the questionnaire, and this is what was really interesting. And this really did inform the next part of the research. So I asked them a whole range of the questions really were: would you be happy for an advanced paramedic to perform these skills on your behalf? Okay, so that was quite a significant question. I won't go through them individually because I'm looking at the evil eye of Anna here, and I don't want to be slapped for overrunning. But you could just see it there yourself. It was actually phenomenal that there was unprecedented support for this. And I was surprised by that finding, I have to admit. And that was everything from cardiovascular examinations to management of acute respiratory emergencies, right down to even performing an examination and management in the patient's home on the GP's behalf, and also in the GP surgery, which I thought was very interesting. So then that moved on. Then we got to that informed in the interviews. And the main themes that came out of the interviews then were current and future healthcare challenges, primary care and paramedicine partnership, how this might work, and then from theory to tangibility, how this might actually come about. So sustainability, and this was a recurring theme that came back, and I probably could have another paper just on the challenges facing rural general practice in Ireland alone, and that's something I'm looking into. But once you open the floodgates, I probably made the mistake. I asked a GP, so tell me what your problems are. So some of the interviews went on quite a while, and I realised an hour into it I still hadn't actually asked anything that I wanted to know. But it made for fantastic, and their testimonies, and I state this actually in the paper, I don't think their testimonies have been actually recorded in such a way, such honesty. It's actually humbling to have been part of it. Obviously, capacity and workload, and this is the same thing, the fear among GPs, elderly population, of the general practitioners themselves. Who will replace them? We all know, anyone that lives in rural areas, we cannot have incentivized GPs and young GPs. We're training as many as ever, but they're just not staying in the system. And this is going to be a huge problem. And people living in remote and rural areas are going to be disenfranchised as a result of this. And that was a huge, huge issue. Again, I won't go through all this, but this is just some of the direct quotes that was really important. I just really, this is a GP, one of the GPs. It's not sustainable. We're not training nearly enough doctors who want to stay in the system. There's a lot of towns and small villages without a GP at all, and that's only getting worse. And that's the thing, and that's what we're seeing then as well, and just in relation to the next thing, is because we're seeing that in the ambulance service, we're seeing that the knock-on effect of that is because people can't access services, who are they going to call? Ghostbusters. Who's going to come in the big yellow van and pick them up? The ambulance service. So we're now bringing patients into the ED department who don't necessarily need to be there, and that is a problem. We're contributing to the ED overcrowding, and that's something that really needs to be looked at. And that's because people just can't access services in primary care, and especially out of hours. This was some of the stuff then, so primary care and paramedicine, the partnership, and this was something that came out of our services. The GPs actually contacted me in relation to this and wanted to set up a pilot study straight away. They wanted this up and running. I won't say where, but they actually wanted this up and running. I'd say I could have had it, by the end of the week, we could have had it if we could have. That's the appetite there. And we all know this in relation to out-of-hours services. Again, we've been Now Doc, Mid Doc, West Doc, and all the other doc schemes. Again, it is so hard for GPs. They're not able to provide the out-of-hours services that they used to provide when we were children, back in the day. GPs are not providing home care visits. They just can't. They just don't have the time. Being part of the primary care team, that was another theme that came through there, and felt that the skill set of the advanced paramedic could seamlessly be adapted. The advanced paramedic, in fairness, paramedics in general have been very adaptive. I suppose we're a new enough profession, and I suppose we're still finding our own feet. But we adapt very quickly in times of, I suppose, crisis. So then the GP-based advanced paramedic, this was an unusual one. I didn't expect this to come out of it, but of course this probably came out on the basis of the fact that we were in COVID lockdown at the time. They were spending so much of their time triaging patients on the phone. And they felt that that an advanced paramedic with our skill set and our clinical exposure to patients, that we would be able to take that workload off them. That was something that they looked at, and that was something that was an unexpected finding, I should think. Then theory to tangibility. How could we get across it? Oh, she's looking at me, right? So just generally, there was overall consensus, and this is what was really remarkable. Absolute full consensus. There was no dissenting voice among all the participants, which was really, really phenomenal. Communication, basically, I'll cover over these, but everything that came up, communication, innovation, employment, all these things, they felt, this is not a problem. We can get over this. We will find a way. And the big thing was, we're private operators. We'll find a way. We're not state. We will work through it. And again, that's just some of the quotes again, just from. And I've so many more. As I say, it's barriers and enablers. I thought there'd be so many. I never came across such a group of enthusiastic people, and maybe that just shows the disparity of where they are. I don't know what it is, but they said remuneration, indemnity, funding. We'll get over it. We'll find a way. It was phenomenal, phenomenal. So just in conclusion, then, I think it really has opened up an opportunity here. And I think in relation to, I think we have to look at task shifting in general, not just in paramedicine, not just in general practice. We have a healthcare workforce shortage globally, rurally, and within Ireland. And I think in order to address some of these problems, we're going to have to look at different ways of doing things. And I just want to leave you with this one quote. I think it just summed things up. Rural practice is very different to urban practice. In rural practice, you could either get a clap on the back or a shotgun in the face. Thank you very much, and thanks for listening.
Thank you very much. That was a really interesting talk, and I'm sorry we didn't give you more time because I could see there was masses more material there. We have time for maybe 2 questions, if anybody from the audience wants to ask a question about this innovative idea. We have one up, Conrad.
Okay, I'll project.
Okay.
Thanks, but I thought that was really excellent.
Thank you.
In your opinion, what's required to move this to the next level, to actually turn this?
How long have we got? It's remarkable. There's definitely a disconnect between government and general practice, and that is something that came through. The burden of running a general practice, I know 2 of the respondents have actually given up general practice because of the red tape and the infrastructure, the problems that they face, and I found that overwhelming. It requires the likes of this, like-minded people to get into a room together that actually want to fix problems rather than meet statistics. And as Mike alluded to earlier on, we need to actually, look at the actual problem and see how we can fix it. And these people want to fix it. By God, they want to fix it, yeah.
So all your work will be related to 999 code, common example experience. That's where you'll be initiated from.
And the question there, just because for the audience online, will the initiation of ambulance people working with GPs be through the 999 service?
No, not necessarily. I suppose, just to put into context quickly, I suppose this was done the community paramedicine is now becoming a sort of a global event now. This was pre-community paramedicine, so I looked at it, looking at skill sets now. So what can the advanced paramedic do now? So I would be advocating, and of course this would be down to, obviously how it would work best, But no, that they would work, what was described was that you would work through like the registrar, the GP registrar, that you would work nearly in a place of preceptorship and work with the GPs, and that you would become part of that team and have that effect and work with their patients and probably maybe collaborate with other surgeries as well. So not through the 999 system. This would be predominantly primary, non-urgent sort of chronic disease management, really.
Sorry, would your role then be somewhat similar to the role of advanced nurse practitioner?
Yes, similar in that sense, but the fact that we'd be mobile and we would be, because see the thing about where this came from, we see a lot of, the GP's patients are our patients, but the problem is we don't talk to the GP. So the GP is there, I'm going out to see your patient, but I can't pick up the phone and say, Anna, I've got Mrs. Murphy here and she's presenting again, when did you see her last? There's no connect. So we have to bring Mrs. Murphy in because, and I don't know anything about Mrs. Murphy. So that's what I'm saying, that we could, if possible, so if I was maybe had worked under and I was part of her team, I would go out instead. I'd go out and I'd respond and I'd attend Mrs. Murphy. But now I'd maybe talk to Anna, when did you see Mrs. Murphy last? What was her baseline? And we could maybe come together with a care plan, and I would maybe draw up some antibiotics or whatever she requires. We'll treat her at home, and I'll follow up again maybe a few days later, or maybe that day or whatever. So we'll leave her at home. It's all about really treating more patients in the community, but supporting general practice. And the big thing that came out of it was home visits, nursing home visits, the out-of-hours services. We're seeing their patients anyhow. We're just not talking to each other. That's the big thing.
Thank you very much. Thank you.
Thanks very much, guys. Thank you.